talking about that this afternoon. So that's what we do. But our unique selling point is putting the patient at the centre, their perceptions, feelings and emotions and outcomes. This is our first USP. We've got two. And this fits in obviously with a lot of the policy that's already out there now, really putting the patient at the centre. And some of the methodologies that we will be using and do use at the moment, it can range from the sort of really basic, well not basic, but the sort of traditional, the desk research through questionnaire design, workshops, facilitation groups, depths, etc. But where we're moving to is that these can be augmented in identifying richer insights, online communities, which I'll talk very briefly about at the end, word of mouth research. Why do some patients choose to go to that hospital rather than another? What we were trying to get at is really what patients are beginning to feel and think, and real time, thinking about why are they doing this particular thing at this point in time rather than the standard approach of, thinking back over the last 6 weeks, why did you? Also, co-creation. Very important in terms of developing new services, getting the patient to be involved as part of that process. And we can innovate through co-creation. And that's very important. And the online communities and the co-creation can actually work together. And this is something that we're going to be trying to do through our DIABCOM network. And our ethnographic observations. This is one of Charlie's areas of ethnography. But there's loads of scope in which we can use the new methodologies that are coming through. Brain Juicer, for example, is using the concept of we research, looking at what other people predict other people will do. And you can actually do that through ethnographic approaches. So there's a whole gambit of methodologies out there which we want to get involved in and include, and moving away from what is the traditional approach. But collecting and analysing data is only part of the story. Generating insight which leads to actions about getting people to think differently, identifying what matters most and focusing on what is important. We can have that information, but what do we actually do with it and where do we move with that information? How do we help organisations actually use that information? It's management change to a large extent. We can't just throw the data in and expect the organisation to move ahead on that and work with that alone. They need that support. So our second USP is to help you make sound decisions that make a difference. It's critical. We can't just simply provide you with the information. If you want information and data that leads to action, then that support needs to be there. And these are some of the ways in which we can help you transform that knowledge into action. We have our exploratory day, and that is basically how we identify how best we can work with you. We get an understanding of what those issues are, and we talk about how we can work together and what might be the best approach to working together. And then you can decide on the basis of that exploratory day whether you want to work with us or not. It gives you an opportunity to see how things can pan out. And also what we can do after that exploratory day is to go back to you and say, this is what we suggest. This is how we think this should be done. But you are the integral part of that whole process. The rest of the process is that we take, once we're onto that project, 360-degree assessment of the issues. Working closely with stakeholders is absolutely essential. And engaging the end decision makers is also essential. If we want that information to lead to action, we've got to be inclusive. And delivery, an integrated narrative. And this is something that David may talk about in his talk this afternoon. It's important that we actually provide information from the research in context, that it's available for the decision makers. The decision makers can understand the context and then help them make the decisions as to what might be the best approach. And that can also be done through decision facilitation workshops, as well as post-facilitation follow-up. So you're not going to be alone. Moving on now to Diabcom. This is a online private interactive community that we're setting up. It's almost ready to go, and it's been developed at this stage anyway for patients with diabetes, both type 1 and type 2. And it's a private network, so people are invited to attend, and they will then be vetted, and then they can join. And the network itself will enable individuals to put posts on that network themselves, to communicate across one another. But also, what it will do, it'll enable us, the researcher, to get some real-time information about what patients are feeling and thinking in terms of their treatments, their treatment decisions, how they might be coping with their disease on a particular day. But also, from the point of view of developing PROMs, we can use it to do content validation. We can actually get the questions out there and or the concepts out there, identifying what those concepts are around the diabetes for inclusion into any new PROM. So at the moment we do content validation, or we do content generation through focus groups, depths, literature review. This is an added dimension to it, that we can actually get it out there, and one of the things about this system will be that we can actually get it quite quickly. So it's real time. And also we can do questionnaire pre-testing as well through it. And I've mentioned about co-creation. It enables co-creation as well, for us to innovate through the system, getting patients to interact, to tell us what they're feeling and thinking. What is it they want about those services? How do they want those services changed? So we can actually do that through this system. And as I say, it's real time. And at this stage, it's just for diabetes patients at this point in time. But we hope to expand it a bit later on. And we're hoping to have this launched in about 3 weeks' time. So turning now to the supported reported outcome measures, which, as I said before, is an integral part of DHP research. What we can provide in general around PROMs is we can provide strategic advice on design and selection of particular instruments. And we're not alone here. There are other organisations we know that do this. We can undertake literature reviews. We can also do concept and endpoint model development, as well as doing the qualitative stuff, as I've already mentioned, through Diabcom, for example, focus groups, and depths as well, to identify what the underlying concepts are, as well as questionnaire design.